he goes on rifaximn. He starts
Okay.
CBT.
Okay.
And he returns in 1 month and the diarrhea is better, but the pain and job-related stress continues.
Okay. And may I just make one comment, that may help many of our listeners is, for many of these patients, why CBT for this or some counseling would be helpful is, a lot of these patients, they start to really fixate on their urgent diarrhea. And they say, I feel like I might get the urge and then I can't go out, or I feel like I might get the urge and I can't get in my car to go to work, or it's going to happen on the subway. And then it becomes this horrible vicious cycle. So for somebody like this, it might be very helpful. This patient now, okay, so the rifaximn helped the diarrhea, pain continues, and job-related stress continues, and we're assuming he started CBT.
He's had
Lynn,
2
since
sessions.
I started, I'm sorry?
He's had 2 sessions so far.
2 sessions. All right, so that's really not adequate. So one is, he needs to continue. He needs to do his homework. This is a work in progress. I would encourage him. We've seen some benefit after many years of symptoms. This is great, but this is somebody again now where maybe you jump in and you use a low-dose tricyclic agent, a neuromodulator for pain to help with diarrhea, maybe stress, and use a tricyclic, a tertiary amine, amitriptyline, or imipramine, which will probably provide better benefit than a secondary amine.
Okay.
I think he probably needs some help while you're waiting for the behavioral therapy, because often it could take 3 months. Usually these treatment trials are 12 weeks, and they even have a more benefit even later, like at a year. But if the pain is so bothersome or it's impacting his quality of life, then you would have to try to intervene with some pharmacologic treatment while you wait for behavioral treatment to take effect, and then you can taper them off of it.
Right. Mm-hmm. And here we are getting into augmentation. We're adding CBT. We're adding a tricyclic in addition to the rifaximn. Nothing wrong with that. So you do that, and he's better. Okay. Good suggestions.